Hello and welcome. I wanted to personally welcome you to the Core Wellness family. The following training is going to be delivered by Connie Meyerowitz. She's one of our most beloved therapists and presenters, and I think you'll see very quickly how endearing she is and how knowledgeable she is on and passionate about the topic of ACT. It's a phenomenal modality which really helps clients. A lot of people report that it's very familiar to them because it has a lot of components from all different types of therapeutic models that come together. Especially mindfulness, but most importantly, it's a very empowering model. And so I really hope that you'll enjoy this 3-hour training. And I challenge you to take notes, at least mental notes, but maybe even physical notes, to be able to apply the things that Connie teaches you to your personal practice. I think you'll find it very rewarding. And as we always say, it can make an impact in your life as well. The ACT principles are very empowering. They recognize and acknowledge that life has challenges. And as therapists and as people, sometimes it's impossible to overcome those challenges by changing them. We can't change difficult people. We can't change difficult situations. But by being in touch with ourselves and centering ourselves and learning effective coping skills, we can really make a difference. These core components, these 6 core components of what makes up ACT are very powerful tools that are going to have a profound impact on yourself and your clients as well. Just a reminder, this is a home study course, so you take it at your own pace, and you'll be awarded when you finish the quiz and check out. You will, if you haven't already, when you complete the quiz, you will be awarded a certificate. We usually get it out pretty quick, but we ask for 48 business hours. If there's ever a problem or question, you could always email or call us, and we will be certainly sending that your way. The quiz can be taken multiple times until you pass, although to date we've never had anybody hit any problems. You watch the video, and it's just a very couple of simple true and false questions. You can take a look at it right now. So I hope you enjoy. This is a home study course at your own pace, Category 2 or Category B trainings. And for live trainings, visit us at corewellceu.com. And for our other many home study courses, which we're always adding to every month, you could visit corewellceu.com, and you'll see that link for Category 2, or you can type in /home study as one word. Thank you, and I hope you enjoy.
So, before we begin, if everybody just doesn't mind introducing themselves, just type in your name and a little bit about yourself, like what you do, and if you have any experience with ACT, which stands for Acceptance and Commitment Therapy, and then we'll go around the room here as well, and everybody can introduce themselves and talk a little bit about their experience, what they do, and what their experience is with ACT, if they have any. You don't have to, just curious. Alrighty. Would you like to begin? Sorry, I'm cutting you off. You're on the phone.
So my name's Alex, and I'm currently a social worker at a DC charter school, a social worker and sped coordinator. So I have 2 positions there.
Cool.
Yeah, I teacher.
Yeah, I do IT. I know.
Okay, and you don't have any experience with ACT yet? Okay, cool. Thanks. Anyone on here? Not yet. Webinar people, please share. Susan said, I have no experience with ACT. Okay, well, welcome. We're happy to learn together. Lisa wants to learn about ACT. Great. Okay. Dr. Friedman.
Hi, I'm Michael. I used to work in the school system, but I'm retired.
Okay.
And I like to act up.
Alrighty. And anyone else on the webinar? We have Susan, Lisa, Nicole. Are we missing anybody?
There's a couple of names. There's 4 or 5 names.
Yeah. It says that there's 8 people on there. So anyone else want to speak up? You're more than welcome to. Oh, and Mary Beth did. Awesome. Okay, great. So my name is Connie. I'm a social worker. I work here at Recovery Counseling Center /Core Wellness. And I function as an outpatient therapist, see individual clients. And my experience with ACT has been that, well, it started a few years ago. I took a training which was like an 8-week training with Dr. Russ Harris, who's based out of Australia. And the training was really enlightening and very helpful. And ever since then, I've been using ACT primarily with treating my clients. Most of my clients whom I treat here come in because they have issues like related to anxiety, depression, transition issues, some ADHD, some bipolar. And I find ACT to be effective in treating all of them in some capacity. I'm not going to say that ACT is the only thing that I use. It's definitely not. I try to use whatever the client needs. But ACT is definitely enriched my repertoire, my toolbox, in the kinds of techniques that I teach clients and the kinds of techniques that I use in session. So I am super excited to share some of those things with you because I think that hopefully you're going to find it helpful as well to in your work with your clients in really any setting. So and let me know like where and what you think would be helpful and what we talk about. Okay, so we start with, let me make sure I'm going the right way. Here we go. Where did ACT come from? So just the basics, a little bit of history, background about ACT. So number one is it was started by Stephen Hayes in 1982. It's the pragmatic, which means practical philosophy of functional contextualism. We'll talk a little bit about functional contextualism just to get the background. It's a little bit technical, but just so that you get it a little bit more. And it's based on relational frame theory, which we'll also talk a little bit about. And it's a child of both cognitive and behavioral approaches, which basically means that similar in a way to like CBT or other behavioral approaches, it combines using cognition and meaning thoughts and behaviors in order to help treat the client. Something interesting about Stephen Hayes is that he is a psychologist and he suffers from depression himself. And the way that he came up with ACT was by basically trying things on himself. He recognized that he was feeling depressed and nothing was working for him. So he tried to figure out what would work for him, and that's how he came up with ACT. So to me, that says a lot, because if somebody is suffering and they figure out a way to help themselves and it really does help them, then that seems to be, you know, kind of a promising technique, modality in helping clients, other clients who may be feeling depressed or anxious or would have other mood issues. So we lost you at the intro. You keep freezing. We need you to stay for that. I don't know what to do about that.
Is that funny looking man?
Thank you.
There's food out here.
So I'm going to pause for 1 sec. I can no longer see the video. That is Ebony. What?
Can they hear?
Do you hear me? There's an 8-second delay on the video. I don't know why they can't hear me. Or they can't, the video freezed. Something's freezing.
Well, the video, don't worry about. It'll come through eventually.
That's what someone said.
Yeah,
They
no, I
lost
see.
me at the intro.
Okay. Let me see if I plug in. One of the problems is that the screen is very bright. So what I'll do is I'll project this here. Sorry. So you're going to have to move your head.
Dr. Freeman's going to have to move
Yeah,
himself.
because that's part of the
Yeah.
problem. There's too much light shining on you, so it's making a dark background. The other one is, I think it's better if you sit, so they can see you.
That's fine. As
And
long as
then
everyone else
let
can
me
see
just
me
move
in
this.
here.
Yeah, I think they're fine. And then,
Or turn off the light.
well, let's see. Let's see how it. No, it's much better now.
Okay.
See, now you can actually see you.
Where if I do probably. I have my patients and conversations.
Okay,
Don't
and then
worry, I knew it myself.
that should take care of the volume issue also. You guys warm enough in here, by the way?
I'm out there.
Do you have any idea why it's freezing?
Yeah, don't worry about it. It's just the connectivity. We're good.
Everybody hear me and see me now?
It should be much better. Okay. Give it a try, and I'll log in and I'll see.
You're a very nice man. Thank you.
Thank you.
Thank you. We appreciate all of your technical support.
That's right.
It should be much better now.
Okay. Alrighty, everybody. I think we are. You only see part of my face. Thank you. How's that?
It's a good sign.
Great. Okay. We will continue. Think we're good. Sorry if I get cut off sometimes if I'm moving around. I will try to come back to the front of the camera so you could see my face and it doesn't look like I'm talking to you from I don't even know where. Alrighty. So we are up to, we just talked about Stephen Hayes and how he used ACT, or actually came up with ACT for himself in order to help himself deal with his own depression. And now we are moving on to the next slide, which is about functional contextualism. So functional contextualism talks about the function of thoughts rather than the content of thoughts. Now, the reason why this is important is because in ACT, we're interested, like it says in the third point over there, we're interested in the function of thoughts rather than the form of them. Since our goal in ACT is to influence our behaviors and to influence the way that we feel and the way that we, really the way that we act, then the reason why we're interested in the function of the thought is because sometimes the function of a thought can seem bad. Actually, the content of the thought can seem bad, but the function of the thought is not. So an example of that would be if, let's say, I say something like, my thought is, I stink at math, right? Now, the content of that thought sounds bad. So in cognitive behavioral therapy, they would say, well, that thought is a bad thought. How can we change that thought? How can we challenge that thought? What can we do about it in order to try to get rid of it or minimize it? In ACT, we would say, well, what is the function of that thought? What is the outcome of the behavior of having that thought? Meaning, if I then use that thought of I stink at math to motivate me to then study for my math test and do well on it, then the function of that thought is actually good. So in ACT, we're concerned with the function of a thought. What does it make me do? Rather than what is the actual words, what's the actual content of the thought. Does that make sense? Yeah? Okay. So, and again, that is, sorry?
The function of thought makes you do something? The function of thought, how you express it behaviorally? Is that what we call that?
So, I mean, it could be expressed behaviorally, but the idea of it is that if we're comparing it to cognitive behavioral therapy, what we're saying is that it doesn't, in cognitive behavioral therapy, we're concerned with whether a thought is good or bad. In ACT, we're not concerned with whether the words of the thought are good or bad. We're concerned with how they make us feel or what they make us do.
Okay.
So in ACT, like you said, it's not necessarily going to make us do something, but it'll likely make us feel something. Like in in cognitive behavioral therapy, that classic the feeling, thought, action triangle. So in here, in cognitive behavioral therapy, what they would say is the thought is bad, the feeling is bad, the thought is bad, so the action will be bad. In ACT, we kind of cut it off where we say, well, let's look at the thought for a second. Is the thought actually going to cause me to feel or do something bad, or do something negative or hard or difficult, or feel something negative, hard, or difficult? Or is the function of that thought actually something positive? How does the thought function in my life, in the client's life? We're good?
Yeah, perfect. Question from Lisa.
Where? Okay. So, ACT is feel or do, and CBT is good or bad. Yeah, in a way, ACT is feel or do, and CBT is good or bad when we're talking about thoughts. That's a really good way to put it, Lisa, actually. Because in ACT, if you look at what we see up here in our slides, our goal is to predict and influence that behavior by considering why the behavior occurs in that specific context. So it's not about, like, it's not even necessarily about the actual thought, it's about what's actually going on. So you have to look at the whole context of what's going on here, and by seeing the whole context, that's when you understand whether the thought functions in a good or bad way, whether the thought functions in a way that's making us do the things that we want to do or do the things that we don't want to do. And that's why the example of, like, X is bad, or I'm bad, or I'm bad at this, or I stink at this, or I'm never able to do this, it's important to look at what that thought, what's the next step? What does that thought bring me to? And therefore, by understanding what that thought brings me to, does it bring me to motivate me? Does it bring me down? Does it make me feel worse? Does it make me feel better? Then I understand how that thought functions in the context of this person. Does that make sense, Lisa? Yeah, okay, great. Okay, let's move on to relational frame theory. Now, the reason why relational frame theory is important is because this is also one of the kind of like the fathers of ACT, where ACT comes from. And the idea of relational frame theory talks about the idea of language and our connections in language. So if we talk about, if you see in the second bullet, it says the idea that relating one concept to another is the foundation of all human language. So technically, when you think about a word is just a jumble of sounds. It's not actually anything. It's sounds that humans put together to create words and then put meaning to those words. So if you think of an infant, let's say, or a baby, and you're trying to give a baby a meal, them dinner, right? So whenever you say it's dinner time, you put them in the high chair, you put some food in front of them, and you start to feed them, or they start to eat. So sooner or later, they recognize that whenever you say dinner, that means I'm going to eat in the evening. And so dinner, the word dinner doesn't actually necessarily mean anything, but as humans, we gave the word dinner meaning by doing something, which is eating in the evening time. Now, if let's say you tell a child, well, another word for dinner is supper. So they could meld that together into one category, and dinner and supper means I'm going to be eating a meal in the evening time. Now, the reason why this is important in ACT is because words can bring on a lot of meaning and a lot of feelings for people. And sometimes those words are helpful, and they make us feel better, or they make us do things that are important to us, or they push us in the right direction. But sometimes those words which we give meaning to could be very debilitating. And when we're able to kind of tease out that sometimes a thought or words are just words, and they're not necessarily my reality, or they don't have to be my reality, or this is the way that I feel, or this is what I'm thinking about, but honestly, these are just words, then sometimes that can help us in working through something. And we're going to talk more about that when we get to one of the 6 core ACT principles, which is called diffusion. And diffusion talks about creating distance from our thoughts. And one of the ways that we do that is by looking at thoughts as words, rather than having such a strong meaning to be attached to. Now, does that make sense about relational frame theory? Does everybody get that? So just to repeat that for a second, the words that we think have so much meaning and power that sometimes it's overpowering. And that is where some of the ACT techniques like diffusion come in, is where we try to make those words less overpowering. Okay. Where are we? Okay, we are by the aim of ACT. What is the aim of ACT? So, in one sentence, it's to create a rich, full, and meaningful life, sorry, that's supposed to say while accepting the pain that inevitably goes with it, which means that we're trying to create a life for ourselves that we want, what we want it to look like, not being stuck and sucked into pain, sucked into anxiety or depression. We're trying to utilize techniques in order to help our clients get out of that place so that they can make choices about what they want their life to look like. One of the things, we're going to see a video in our next slide, which is kind of like an overview of what the idea of ACT is, what we're trying to get to. And you'll see that one of the things that he says in the video is towards moves and away moves. So towards moves, what that means is that we're going towards the direction, headed in the direction that we want to be going. Away moves means that we're doing things that bring us away from that direction, that are helping us hide behind our anxiety or depression or whatever is going on, in order to be able to not have to feel that pain, feel that difficulty. And a lot of times away moves could look like addiction, or let's say somebody who is agoraphobic, not going outside or doing things like that, that pull them away from the rich and meaningful life that they're looking to have. So in ACT, it's not just about like, let's see what we could do with these thoughts. It's about having we want our clients' entire life to look better. We want them to be headed in a direction that they want to be headed. And we'll see later, one of the other 6 core principles of ACT is values. So when we look at when we're talking about values, what we're saying is, what are the towards moves that you want to be doing in order to be able to be fulfilling the values that are important to you? So it's not just about, let's get rid of anxiety, let's get rid of depression, but it's also about what's the direction that you want to be headed in. And another super important thing about ACT is that if you look at the second point over here, the aim of ACT is to not control our difficult thoughts, memories, and feelings. Now, if we do a quick exercise here for a second about that, so we understand what that means to not control our difficult thoughts, memories, and feelings. So the first thing that I want you to do is, this is a really common one. Don't think about pink elephants. What are you doing? Thinking about pink elephants, right? So that proves to us that you can't control your thoughts, because if you could control your thoughts, then you wouldn't think about pink elephants. And a lot of times, what I tell my clients is that when it comes to thoughts or when it comes to feelings, and when you're having a negative thought or a negative feeling, then if you could choose ones, wouldn't you choose different ones? Right? If you don't want it, then why not choose a different one? Well, if you could, you would. So obviously you can't. Another one is, now I want you to take your right foot for a second. I do this with clients all the time. Take your right foot and make it go numb. Is it numb? No. So we don't control the sensations in our body either. So we know that we don't control our thoughts, we don't control our sensations. Now here's another one. Think about what you did when you woke up this morning. You woke up, you brushed your teeth, whatever it was, you got out of bed, got dressed. Okay. Now erase it. Can you erase it? No. So that's another thing that we don't control. We don't control our memories. So when memories pop up for somebody and they're like, why doesn't this just go away? Well, we don't control it. It's really hard, but we don't. And the last one is about feelings. So pretend like in your room right now, if you're on our webinar, pretend like there's a homeless man sitting in your room. And we're going to pretend like there's a homeless man sitting right here next to us in this room. Now he's kind of dirty, he's kind of gross, he hasn't showered in about 3 months, and he's pretty smelly. Now, his name is Tom. Now let me ask you, do you love Tom? Anybody here love Tom? No, I don't love Tom. Now, what if I say, I'll give you $1 million. Now, do you love Tom? You do. Well, we can say it, but do you actually feel it?
Oh, yeah.
Now, what if I told you, I'll give you $1 million if you give Tom a hug? Can you do that? Yeah. So I can't force myself to love Tom. Even if you give me $1 million, the feeling of love doesn't come. But I can do something. I can give him a hug, and that's fulfilling every requirement that you said to get that $1 million. So I can't, no matter what, I can't bring on a feeling for myself. If you tell me, feel love, feel anger, feel sadness, I can't make myself feel it, even if you're paying me. But if you tell me to do something in action, I can do that. So those are just a few little exercises that proves that we don't control our thoughts, we don't control our feelings, we don't control our sensations, and we don't control our memories. So the reason why that's so important is because sometimes people spend so much time trying to control those things and make them go away. If our thoughts, memories, and feelings are not controlled by the self, who or what controls? So our mind, that's a very good question. That's something that we're going to get to. Our mind is almost like, what ACT calls it is like our mind is like this machine that lives in our body that we don't control. And it generates thoughts and feelings, memories, sensations, all these things. And then it pops up, and then we have a self that's separate from our mind, which we're going to get to, which is called, when we get to the observing self, which is another core principle of ACT, which then can say, wow, I can see this thought. Now, what do I want to do with it? So our mind generates a thought or a feeling, and then there's a part of us that's a self that can observe those thoughts and say, well, what am I going to do with that thought? How am I going to deal with that thought now that it's here? Does that make sense, Lisa? So now, here we have our video, which is talks about ACT.
All day long, humans are doing things. We're always doing something, even if it's just sleeping, we're always doing something. And we can broadly classify what humans do into two large groups of behavior. We can talk about towards moves. We're doing things where we're acting in line with our values, behaving like the sort of person we want to be, acting effectively, doing things that help to make life better. Or we're doing away moves, moving away from our values, behaving unlike the person we want to be, acting ineffectively, doing things that don't improve life or make it worse. And what we're aiming to do in this course is give you a lot more choice so that you can choose to do more towards moves. The more you choose towards moves, the richer, fuller, and more meaningful your life is likely to become. The more effective you are likely to become at creating the sort of life and achieving the sorts of goals you want to achieve. Now, what happens is that in a challenging situation, difficult thoughts and feelings show up for us. And when we get hooked by those difficult thoughts and feelings, we tend to start doing away moves. Difficult thoughts and feelings might include depression, anxiety, stress, pain, suffering, fear, anger, guilt, really, thoughts about not being good enough, thoughts about failing or screwing it up, a whole range of difficult thoughts, feelings, emotions, memories, urges, sensations. When we get hooked by this stuff, typically our default setting is we get pulled away from our values and we start acting ineffectively. And so what I'm aiming to do in this course is give you a lot more choice so that when you're in those challenging situations, whether it's relationship issues, health issues, financial issues, work issues, whatever those challenges are for you, when those difficult thoughts and feelings are showing up for you, I want you to be able to unhook yourself from those thoughts and feelings and make a choice, a wise choice, a choice that you decide as wise. I want you to have the freedom to choose towards moves, if that's what you want to do. So to do that, I'm going to introduce you to a bunch of helpers that are going to help you to unhook from the difficult thoughts and feelings. And those helpers fall into two categories. Firstly, there's values, so we're going to spend a lot of time clarifying what values are, and using those values to set goals and create action plans and guide what you do in this life as you move forwards in the face of your challenges and difficulties. And we're going to be learning mindfulness skills, skills that help you to unhook from difficult thoughts and feelings and refocus your attention on what's important and engage fully in your life and live in the present moment and make the most of this moment of life as it is right here, right now.
Okay, great. So was that clear? The video, did that kind of clarify a little bit about what ACT is doing, what we're talking about? Awesome. So the next, anybody on the webinar have any questions about the video? Any comments? Please let us know. The next, so now that we get what ACT is talking about, an overall look at ACT, now we're going to talk about the 6 core principles of ACT. So there are 6 different ways that ACT works through dealing with difficult thoughts and feelings, and then also creating that meaning in a person's life. So there's contacting the present moment, which is living in the here and now. We're going to go into each of these in depth. But just an overview for 1 minute is contacting the present moment, which is living in the here and now, which is basically mindfulness. Then there's diffusion, which is watching your thinking. And diffusing means creating distance from thoughts. Then there's acceptance, which is opening up and making room for thoughts and feelings. Then there's self as context, which is the observing self that I mentioned before, which is pure awareness of thoughts and feelings and things going on in your mind as well as things going on around you. And then there's values, which is now that you got all this, which is all these techniques in order to help a person pull away from anxiety or depression or difficult feelings or thoughts. Now we want to say, well, where are you going with that? Now that you've been able to pull away and you're not so sucked into dealing with that or sucked into not dealing with that, then what do you want to do next? So the next thing is that we talk about is the direction, the towards moves that video was talking about, which is having values and knowing your direction in life. And the next thing is committed action, which is the problem-solving part of ACT, which talks about, well, now how are you going to get there? What are you going to do in order to make sure that that happens? And that last point over there, which says this is all in the context of psychological flexibility, which is something else that we're going to talk about. But psychological flexibility, in short, what that basically means is being able to jump from one core principle to the next, in order to be able to utilize what the client needs at that moment. And also being able to be flexible when a person themselves is utilizing ACT, being able to be flexible in their own use of ACT and doing what they need at that time. And Susan asked, can you access the video? You can access the video on YouTube, actually. You just could type in Russ Harris, because he's the person who I took that training with, and he has lots of videos posted on YouTube, and you write The Choice Point by Russ Harris, and it should come up for you. There's going to be other videos on here that are also really helpful, which are also from him, which you can also find on YouTube. Okay, so let's jump into, so this is psychological flexibility. This is actually the 6 core principles of ACT. They call it the hexaflex. I know that's a big word. Basically, it means there are 6 different points on this, which are the 6 core principles of ACT. And we're jumping from one to the next, and we're utilizing what works at that moment. And if you look at the bottom of that slide over there, there's a little blurb about taking an ACT history, which talks about the different, how you target the different parts of the different 6 core principles when you're taking the history in ACT, which is just like an interesting little point that could be helpful in utilizing the techniques also. Now we're going to jump into getting into the details of what each of the 6 core principles are. So contacting the present moment, like I said before, is basically mindfulness. Now, before we get into it, what has everybody's experience here been with mindfulness? If you don't mind typing on the webinar, have you used mindfulness before? Do you use it with clients? Do you find it helpful? Anything you want to share about mindfulness? And also, you guys in here are welcome to share as well.
I heard about it once, maybe.
Sure.
Maybe you can teach me some.
No, Dr. Friedman, please. Can you please share with us a little bit about your experience with mindfulness?
I read
An article once. Sure. Ebony says she hasn't used it yet. Okay, great. Well, I'm excited for you to learn about it. Susan uses it with herself and with clients. Nicole says that she uses it with her patients that she works with who suffer from eating disorders. You did mindfulness groups. That's super cool. Okay, great. Well, mindfulness, if you look at the first point on our slide right here, is paying attention with flexibility, openness, and curiosity. So what that basically means is that a lot of times, especially people who are feeling anxious or depressed or have other difficult things going on in their life that they're preoccupied with, they spend a lot of time thinking about what's going on in their heads and not a lot of time being present in what's going on around them. So an example that I like to give with clients a lot is that I'll ask them, like, when's the last time you drove home? Right? And you drive home probably multiple times a day, at least once a day if you're driving home from work. And there are so many times that you end up going, let's say, from work to home, which is something that you do so often that you don't even know how you got there. So in that, when somebody's doing that, they are being the opposite of mindful. They're being sucked into their brains, sucked into their thoughts about whatever's going on. What do I need to make for dinner? I need to do laundry. I need to call this person. What's going on with this thing in my life? And they don't end up focusing on what is going on in front of them, what they're actually engaging in. So when somebody is mindful, they're pulling themselves out of being stuck in that loop in their brain and being present with what's going on around them. Now, there's actually another type of mindfulness, which is, if you look at the last point over here, it says flexibly bringing your awareness to the physical world around you or the psychological world within you, or both. Now, what's important about that is that sometimes we meet clients who are very avoidant and they don't want to think about the thoughts that are going on in their head, and they try to distract themselves with so many things. And with those people, it's important to be able to help them contact what is going on inside of them. Contact those feelings and those thoughts that they're trying so hard to avoid. And we're going to do an exercise here that helps us kind of understand what mindfulness looks like, both when you're contacting the outside, when you're contacting your environment, and mindfulness when it looks like when you're trying to contact what's going on with a person's internal experience. And Mary Beth also shared over here that she uses mindfulness with herself and with clients with mood disorders. Awesome. Okay, great. So let us do this exercise now. I'm just going to...
I'd like to introduce you to a little exercise I call dropping anchor. To prepare yourself for this exercise, please get yourself into a comfortable position, ideally sitting in a chair, and make sure that you're somewhere where you're not going to be distracted by phone calls or emails or people or pets. A good way to start this exercise is to just get in touch with something that's a bit difficult in your life today. Just bring to mind something that you're struggling with, that you're anxious about, or upset about, or annoyed about, or frustrated about. See if you can just tap into a bit of emotional discomfort. Not a full-blown emotional storm, but, something that's a little bit painful for you. And when you have a sense of tapping into that, the first step then is to simply push your feet hard into the floor. Push your feet hard into the floor. And at the same time, straighten your back and take your hands and gently press your hands together, feeling your fingertips. And then feeling your elbows and feeling your shoulders and your shoulder blades. So pushing your feet hard into the floor, feeling your legs, pushing your hands gently and firmly together, feeling your arms and your shoulder blades, sitting forwards in your chair, feeling your spine and your neck, so that you're now aware of uncomfortable thoughts and feelings, some emotional discomfort, and you're also aware of your body, your arms and your legs and your body around those feelings. Now, at the same time, also look around the room. Look around the room and notice 5 things that you can see. And also open your ears and notice 3 or 4 things that you can hear. So maybe my voice, maybe sounds from the computer, maybe sounds that you're making, maybe sounds from the room you're in or your environment. So now you're aware of your emotional discomfort, your emotional pain, and your arms and legs, and the room around you. And also really engage with me. There's you and me here working together as a team. So there's your body here, there's you and me here, there's a room around you, as well as this emotional pain. And hopefully, as you do this, you're already starting to get a sense of dropping that anchor, grounding, centering yourself. Now just move your arms and legs around. You know, kind of stamp your feet, have a stretch, move your arms and legs around. Get a sense you're in control of your actions here. And really come back into the present moment. Notice where you are and what you're doing. And your emotional pain or discomfort may have changed or it may not have changed. The aim of this exercise wasn't to try to control your feelings. It wasn't to get rid of the discomfort. So if your emotional pain reduced or disappeared, great, bonus, but not the point. You know, when you drop an anchor, you're not trying to control the storm and make the storm go away. You're trying to hold yourself steady. So you can really use anything to drop an anchor, anything external to your body, anything that helps you increase your contact with the present moment, so that as well as your thoughts and feelings, you're also aware of the room around you, of what you can see and hear and touch. You're all more in control of your arms and legs. So other versions of this exercise might involve focusing on your breathing, kind of breathing slowly and noticing your breath, or really listening to the sounds in the environment. So you can modify and adapt and create your own versions of this exercise, anything really outside your body that enables you to contact the present moment and expand your awareness so that there's more here than your difficult thoughts and feelings, will help you to drop that anchor, to ground yourself in the present moment.
Okay, great. Susan, am I still frozen? What do you guys think about that exercise?
Fun.
Fun. So what's cool about that, which I think is an important point of what he was saying on the exercise, is that it's not going to get rid of those negative thoughts and feelings. But what the idea is that I can be present of not only that. Okay, good. Thanks, Susan. I can be present and recognize that I'm having difficult thoughts and feelings, but there's also a whole world around me that I could be connected to. Those negative thoughts and feelings don't have to be the only thing that's on my mind. It doesn't have to be the only thing in focus. And when I'm trying to be mindful, I can focus on whatever I choose to focus on. That's the idea of what mindfulness is. I'm being present in that moment. Another important part of mindfulness is when it says openness and curiosity, another word that you can use for that is being non-judgmental. So I'm having a thought or I'm having a feeling that might seem negative or seem bad, but what I'm doing instead is being like a scientist. I'm observing that thought. I'm letting it be. I'm curious about it. Oh, that's an interesting thought. I wonder what comes next. Kind of like I'm reading a story, rather than being caught up in this means I'm bad or this means my life is falling apart. It doesn't have to mean anything. It could just be a thought that I'm looking at. It could just be the world around me that I'm observing, that I'm taking in, that I'm curious about. Now, like we just said before, the contacting the present moment, we can do it either with our external, trying to, like we just did with dropping an anchor, where you're focusing on what's going on outside of you. and also being aware of what's going on internally, but that's not the only thing. Or with a person who's avoidant, and when you ask them, well, what are you feeling right now? They say, I don't know. So with those kinds of people who are very unaware or are scared of facing what's going on inside of them, another thing that we can use is called the halo exercise. Now, part of the premise of the halo exercise is we're gonna help a person focus on what's going on inside of them, which means what's going on inside their bodies. And something that's important to understand about that is that we harbor our feelings inside of our bodies. Different feelings for different people live in different parts of a person's body. So sometimes somebody might describe, like, when they're feeling anxious, that their chest or that their neck or that their throat feels tight. Some people might describe it as stomach pains. Some people might describe it as their muscles relaxing and contracting. So when a person is trying to grow an awareness of their feelings, one good way to do that is to have them turn internal to their body and try to find those feelings inside of their body, and that will give them clues as to what they're actually feeling. So the halo exercise, if you don't mind doing it with me right now, if you put yourself, again, like in a comfortable position, where right now you're doing your best to relax all of your muscles, and we're going to pretend like there's a halo on top of your head. Just this like circle that's like light, and it's around your head and it's hollow. Now, as I say the different parts of your body, we're going to pretend like that halo is traveling down over your body. And as it travels over each part of your body, I want you to focus on that part of your body and see if there's any feelings, sensations, anything that's going on in that place in your body. And if you feel something, then just focus on that and see if there's a feeling, like let's say there's a tightness or something like that. See what feeling comes up for you when you focus on that tightness or focus on that pain or focus on that temperature. Okay, so right now the halo's around the top of your head. And now it's moving down over your eyes and your nose, over your mouth. Now it's over your chin and heading down towards your neck. Now it's over your shoulders and the top of your chest. It's heading down around your stomach. Now around your pelvis. Now it's around your thighs. Now your knees. Now your calves. Now your ankles. And your toes. Did anyone notice anything? Anything important or not so important?
I found an intensity in that part when you mentioned it. Like a real focus on that part.
With each part, you're saying?
Sorry?
Yeah, that's great. Awesome. That's the idea, that hopefully with a person focusing on each part of that each body part, then let's say they'll start to notice a tightness, or they'll start to notice a sensation that they never really were aware of before. And then through that tightness, through the exploration of that sensation, they'll come up with a word. They'll come up with a feeling that they're experiencing that they'll be able to then expand on and understand and not run away from. That's the idea of why we use this exercise, kind of like a slow progression into helping a person let go of some of that avoidance. And it's not as scary as saying, well, what are you feeling right now? Because there's lots of times when people have a hard time expressing those feelings in words, and helping them recognize that those feelings live inside of them, they're in their bodies, can help them feel more comfortable with expressing it. Okay. So that is contacting the present moment. Next is diffusion. So diffusion is a really important one. This is one I use all the time. Now, what diffusion means step back and separate or detaching from your thoughts. Seeing your thoughts as nothing more than words or pictures. Allowing thoughts to come and go as cars passing. Now let's do the hand/paper as thoughts exercise, because this really illustrates what diffusion means. So pretend like all your thoughts, well, not pretend like all your thoughts. Let's take a step back for a second. Put your hand up in front of your face like this. Now, what can you see? Can you see much of anything? You basically see a hand, right? Now, move it back about 5 inches. Now, what do you see? You still see pretty much a hand. Do you see anything else? Like on the periphery, a little bit, right? Okay, now move it back a little bit more, like your full arm's length. Now what do you see? So you see a hand, and you can also see the things that are going on around you, the other things in this room. So your hands, let's pretend like your hands are your thoughts. So if somebody is fused, if they're attached to their thoughts, then all they can see is those thoughts. That's all that's in focus. They can't see anything else that's going on in their life. They can't see anything else that's going on around them. What diffusion says is that it's not that we're going to get rid of those thoughts or that we're going to make them disappear or go away, but what we can do is create distance from those thoughts. So those thoughts can still be here. It's not like I cut off my hand. It's still here. But it's not the only thing that's here. There's those thoughts, which may be difficult, which may be painful. But there's also me talking. There's also lots of things going on in this room. There's also relationships in my life. There's also the other things that I have to get done and focus on. There's also my hobbies and the things that I enjoy. So there are these thoughts that could be very painful and difficult. But there's also so much else that I can focus on. So I'm not going to get rid of those thoughts because that's impossible, like we established earlier when we did those other exercises. But that doesn't mean that it's the only thing that has to be on my mind. Now, when we talk about thoughts, and it says about allowing them to come and go as cars passing, what that basically means is that it's sort of connected to mindfulness in a way, which what we're saying is that thoughts are thoughts that live in our brains, and we can decide if we want to attach ourselves to them or not. So if we pretend like those thoughts are cars passing by on the street, then a thought can come and a thought can leave. I don't have to get in that car and be attached to that thought. I can observe that thought and say, oh, okay, that's a thought, and then move on from that thought and continue focusing on whatever I want to be focusing on. Now, if you look inside of our handouts at, there's a handout in the back that it says thoughts in the middle of the page. Let me find it. Thank you, yes. It is page 5. Right over here. The video people, can you see it? Now, these are all different kinds of diffusion techniques. And I give this paper, I copy it for my clients all the time. So when we observe our thoughts as thoughts, then they're just thoughts. That's the idea. It doesn't have to be my reality. It doesn't have to be what I'm attached to. It doesn't have to dictate the choices that I make. It's thoughts. So these are different kinds of techniques that we can use in order to develop that diffusion. So if we look at on the left side where it says your mind is like, it says a don't get killed machine, a word machine, radio doom and gloom, a masterful salesman, the world's greatest storyteller, a fascist dictator, a judgment factory. So a lot of times I use radio doom and gloom. I tell my clients, so right now, there's this, your mind put on this radio station, radio doom and gloom, and it's playing all these horrible things that are going to happen to you in your life, or all these horrible things that are going on in your life, and there's no way for you to shut it off. You can't make it stop, but what you can do is you can lower the volume. So it's still playing, you can't make it go away, but you can choose to focus on something else. You can choose to turn your attention to something else and lower the volume on that radio station and look at the world around you, or focus on something that you actually want to be focusing on, rather than being caught up in radio doom and gloom that decided to play itself today. Another one is the classics on the bottom. I'm having the thought that. So let's do it for a minute together. Let's say, think of some negative thought. Okay, let's say, I'm never going to be able to graduate. So the thought is, I'm never going to be able to graduate. That makes me feel really down. That makes me feel depressed. That makes me feel sad. Now, what if I put the words, I'm having the thought that I'm never going to be able to graduate? So what that does is it creates distance. That's just a thought. The thought is, I'm never going to be able to graduate. Now, does that have to be my reality? Does that have to be what actually happens? It's a thought. It's a thought like any other thought. Now, even more than that, we can say, I'm noticing that I'm having the thought that I'm never going to graduate. So in that case, you're noticing that there's a thought that you're never going to graduate. So that even hopefully creates even more distance between being fused with, being connected with, being like engrossed and totally preoccupied with that negative thought. It's similar to where it says over here about on the next to the classics, where it says noticing. Notice what your mind is telling you right now. Notice what you're thinking. When you adopt a mindset of noticing, then your thoughts can be something that's there, but it doesn't have to be something that you're super connected with. I'm noticing, similar like we said before, like to being that scientist that's noticing thoughts in your brain. It's noticing whatever's passing by and letting it kind of pass rather than getting stuck on it. Also on the left side, something that I sometimes use also with clients is where it says interested. That's an interesting thought. So sometimes a client will say something to me like, I'm never going to be blah, blah, blah. And I say, oh, that's an interesting thought. So what you're helping the client recognize is that's a thought, it's interesting, and that's basically it. It doesn't have to be more than that. It doesn't have to be something that I live by, that I'm connected with, that I'm married to. It doesn't have to be any of that. It could be a thought. Anyone have any questions? Anyone on the webinar have any questions? Okay. Now, another helpful thing with creating diffusion is labeling what kind of fusion is going on. So there are 1, 2, 3, 4, 5, 6, right? 6 categories of fusion. Past, hold on, let me get to it over here on my slides. Past, future, self, rules, reasons, and judgment. So past means like painful memories, flashbacks, saying things like, I can't do A now because in the past B affected me really badly. Or the opposite, like the past was so wonderful that now is horrible. Future-oriented thoughts, which is worrying or catastrophizing, predicting the worst. Hopelessness, or saying things like, having thoughts like, I can't do A because then this bad thing will happen to me. Or the opposite, like the future will be so wonderful. So, like, that's talking about sometimes with people who are, what's the word I'm looking for? Like people who don't, are not realistic about what the future will look like, and they're getting like caught up in that rather than like focusing on what they should be focusing on.
Delusional?
What?
Delusional?
Delusional. Yeah, it could be delusional. Self, that's another category, which is talks about like negative self-judgments, like I'm bad, I'm unlovable, I'm worthless, or things like positive self-judgments, like I'm wonderful, I'm always right, which feeds into like narcissism and arrogance or discrimination, or identifying with a specific role, like I'm a parent and I identify only as a parent, I have no self outside of that, or a sick role, or over-identifying with an occupation, or even over-identifying with a label, like I am borderline, I am depressive, or even things like I don't know who I am and I'm going to stick with that. The next one is rules. So all the rules that a person might make about how I or others or the world should function, like I must not make mistakes, or they shouldn't treat me like that, or my kids should be more respectful. So anything which has identifying words like should, have, must, wrong, fair, unfair, can't, until, shouldn't, unless, all those kinds of things which have like kind of like contingencies or finalities, those are usually rules that a person is kind of like subjecting themselves to or only living by, and that creates a very narrow way of viewing the world, or way of viewing themselves, or way of viewing their thoughts. And that could be kind of debilitating and limiting. Lisa said, I like the create distance examples. Okay, cool. The last two are reasons, which is all the reasons why I can or won't change. I can't do X because I'm too Y, like I'm too depressed, I'm too tired, I'm too anxious, or Z might happen, a bad thing might happen if I try. What else? Like bad outcomes, having a fear of failure or rejection, or making a fool of myself, or things like I shouldn't have to because it's not my fault, the other person should be responsible for that. I've tried before and I failed, so it's pointless. And then the last one is judgments, which could be positive or negative judgments about past, about future, about self, about others, and all these kind of overlap. There could be like a few of these categories within one thought. And the idea is that when I label a category, when I say things like, oh, this is me focusing on the past, or this is me giving reasons, or this is me judging, then I can create that distance by saying, oh, this falls into that category, so therefore it's just a thought which is in that category, and therefore I'm going to now I now created a choice for myself of whether I'm going to continue to play into that thought, or I'm going to distance myself from that thought. I'm going to do something in order to focus on a different thought or focus on something else. So by giving ourselves those categories, we create that ability to say thoughts are thoughts, rather than thoughts are my life, or thoughts are my future, or that these things are true, or that these things are what I have to live by or have to dictate my choices. So far we've talked about contacting the present moment, which is mindfulness. And then we talked about diffusion, which is creating distance. And now the next thing is acceptance. Now, sometimes there's a little bit of confusion between when do you do diffusion and when do you do acceptance. Now, acceptance means opening up and making room for painful feelings, sensations, urges, etc., whatever it is that's going on inside of a person. Sometimes you got to do both. First, you have to be able to accept and make room for it, and then when you've done that, when you've done the work of recognizing this is here, then maybe you can create more of a diffusion where you are able to then say, okay, I focused on that, I've dealt with it, I've given it the time and space that it needs, and now I'm going to let it be here, and I'm not going to make it go away, but it's not going to be my focus. Now, the story that I usually tell my clients in order to illustrate what acceptance means is this. So basically what we say is that if you look at the last point on this slide, these feelings are the guy at the party who you don't really want to be there. So let's pretend like you threw a party, and you invited tons of people to this party, mostly people who you want to be there, mostly people who you like. But there's this one guy who you don't really like, but you don't want to insult him because he's still part of your friend group and whatever. But like, you don't really necessarily want him to be there. But you let him know that the party's happening and he shows up. So you have all your other friends there and all these other people there. And those are the people that you actually want to be spending time with. But he's there too. So you let him sit on the couch and you let him chill and you let him be there. But he's not, like, maybe you say hi, you acknowledge like, hey, okay. But then you move on and you go and talk to the people that you want to be talking to, and you go and focus on the things that you want to be focusing on. You play hostess and you do your thing and you hang out with your friends, and he's there, he's chilling on the couch doing his thing, but you're not really doing much with him. You're not really talking to him or interacting with him or dealing with him. You're just letting him be there. So that's what acceptance means. Those negative feelings, those uncomfortable feelings and thoughts, that's that guy on the couch. So you're not kicking him out, you're saying hi, you're acknowledging that he's there, and then you're moving on and you're allowing him to be there, right? You're not kicking him out, but you're not focusing on him. So if you look at that second point on this slide, dropping the struggle and making space for those uncomfortable feelings to be there and stick around. So when you're making space for it, what you're saying is, it's not that I like you, it's not that I want you, it's not that I need you or that I would love for you to be here. I would actually rather you leave, but that's not in my control. So you can stick around and you can do what you need to do, and I'm going to go do what I need to do. So I'm not making you disappear. I'm not fighting with you. I'm letting you be here, and you do you and I do me, and that's it. And sometimes clients can get hung up on the fact of like, well, that means that like I'm going to feel so bad, and that means that I'm letting him win. I'm letting that feeling win. You're not letting anybody win. You're making a choice. You're not focusing on it. You're not making it the primary thing that's what's going on in your life. You're letting it be there. You're letting it stick around, and you're going to continue to do what you want to do even though that feeling is there. Now, the idea is a secondary benefit that we hope by practicing acceptance is that when we let it be there, then it doesn't feel the need to stick around, then eventually it leaves. It doesn't stay around forever. Now, the thing is, though, is that if we do try to fight a feeling, I don't know if you've ever noticed this in yourself, but it definitely happens to me all the time. When I try to fight a feeling, it goes down to the basement and it lifts weights. And it comes back up and it says, I've got something to prove to you. I'm going to show you that I'm really here. I'm going to show you that I've got something I'm going to make you feel this way. I'm going to make you feel upset. I'm going to make you focus on that negative feeling that you're trying to make believe is not there. But as soon as you make space for it and you allow it to be there and you're like, okay, you can stick around. I'm going to go do something else. Then it's like, okay, this is boring. I'm just going to leave now. And it does. Now, in ACT, we don't say that that's definitely going to happen because we can't guarantee anything about thoughts and feelings. Because they do what they want to do. There's this little machine that lives inside of our minds, that lives inside of our brains, called our mind, that does what it wants. So we're not going to guarantee that it's going to go away. But usually that is what happens. It does go away when you just let it be there. Now, something about acceptance versus control. Now, in ACT, we do not advocate for all thoughts and feelings under all circumstances, meaning we do not advocate for acceptance of all thoughts and feelings under all circumstances, which means that there has to be two, if you look at this slide over here, there has to be two circumstances that are present, which tells us that acceptance is what we're looking for rather than control. One of those things is when control of thoughts is limited or impossible, meaning I can't control them. If we look at like ACT versus CBT again, in CBT, we're trying to control them. We're trying to challenge or change them, get rid of them, make them different. In ACT, when it's impossible to do that, when you can't get rid of it, when you can't control it, when you can't make it go away, that's when you say, okay, I guess I got to accept this. Which honestly, in most circumstances, that's most of the time that you can't make it go away. Because a lot of times, with CBT, what I find when I do that with my clients is that the thought still comes back. It's not like it disappears forever. So maybe you could temporarily relieve a person of having that thought or that feeling, but overall it's going to keep coming back. So if you're going to continue to try to control it, it's not like it's not like a forever fix. Therefore, accepting it is usually easier in a way than continually trying to challenge it. So that's number one, is when control of thoughts is limited or impossible. And the second one is when control of thoughts and feelings is possible, but the methods that we use reduce the quality of life of a person. So what that basically means is, for example, if let's say somebody's agoraphobic, and in order to avoid difficult thoughts and feelings, they stay inside all the time so that they don't have to be around people, they don't have to be in spaces that have lots of people or talk to other people, or even it could be social anxiety where somebody's staying inside and avoiding interacting with other people. The reason why they're avoiding is because they don't want to deal with the anxiety that's associated with doing that difficult act of being outside, of being around people. But by doing that, then they're basically limiting or taking away from or reducing their quality of life. And if thoughts or feelings are causing somebody to have a reduced quality of life, then that's a reason why we need to work on accepting those thoughts and feelings rather than controlling them. Because by controlling them, which is what they're doing, basically they're controlling them by staying inside, so they're avoiding those thoughts and feelings, then that's reducing their quality of life. So we have to work on helping them accept that those thoughts and feelings can be there while they engage in an activity that's uncomfortable for them. Meaning, I can still feel anxiety and feel difficult thoughts and feelings while I'm still engaging in a behavior that's difficult for me, but that's important to me in the same time. So I'm going to do something that's important to me even when I'm feeling difficult thoughts and feelings, and that is having that level of acceptance of saying these thoughts and feelings are going to be here, and that's okay because I'm going to do this anyway because it's important to me. Susan said, I like to say, bring the fear with you before taking an exam or going to an interview or joining a party. That's great. Like, you bring it with you. It's not like you're trying to get rid of it. You're not trying to pretend like it's not there. You're letting it be there. Like, it's that guy at the party. You're letting it be there, but you're not, but you're still doing what's important to you, even though it's there. Our next slide is another video, which helps understand, which helps us understand a little bit more about acceptance. It's called The Struggle Switch. Another great video from Russ Harris. But before that, Nicole just wrote on our webinar, how would this change if your client had a thought/feeling about harming themselves or someone else? So that's a good question. I can, with you're saying in terms of acceptance, I guess. So I can still make room for a feeling, but that doesn't mean that I'm acting on it. I can have a feeling of, I want to hurt somebody else or I want to hurt myself, and that feeling can still sit inside me and be there. But like we said before, it doesn't have to be the only focus, and it doesn't have to be something that I act on. Most likely, though, with something like harming yourself or someone else, I would likely use diffusion more than acceptance, because diffusion is helping me create distance from that thought. I would likely probably first start with acceptance of saying, like, that thought is there and that's okay, I'm going to let it be there. And then once I've done that, then utilize diffusion and saying, okay, it's not the only thing that's here. Let me create distance from that thought so I don't end up doing something that I regret.
And you report it.
What?
And you report it.
And you report it. That's true. Nicole said, so you would have to be confident that the client understands what you mean by acceptance. Yeah, exactly. Acceptance doesn't mean I'm okay with whatever it is and I'm going to act on it and I'm going to make it a part of me and I'm going to do exactly what that thought's saying. Acceptance means I don't necessarily want that thought or want that feeling, but this is what's showing up, so I'm going to let it be there. I'm being in that thought. It doesn't mean I'm doing something about it. It means I'm being in that thought. Okay. Here is the video called The Struggle Switch.
it often seems like we've got a struggle switch at the back of our mind. And as soon as an uncomfortable emotion, a painful feeling or memory shows up, it's like the struggle switch goes on and we start to struggle with it. So let's suppose anxiety shows up. Very common, painful emotion that we all get to experience. Anxiety shows up, the struggle switch goes on. Oh, here's anxiety. I don't like anxiety. I want to get rid of my anxiety. Now I've got anxiety about my anxiety. So it's getting bigger. With the struggle switch on, I now get, oh, my anxiety's getting bigger. How do I get rid of my anxiety? Now I've got even more anxiety. With the struggle switch on, I may then get angry about my anxiety. Why does this anxiety keep showing up? I hate this anxiety. Then I might even start to feel sad about my anger. Oh, is this my life? Oh, and then I may start to feel guilty about my sadness, about my anger. Oh, how pathetic am I when there's starving kids in Africa? So with my struggle switch on, my emotions get amplified. I've now got guilt about my sadness, about my anger, about my anxiety, about my anxiety. And that kind of amplification of emotions gives them more impact and influence over my life and often gets me bogged down or pulls me into self-defeating behaviors. Now, what happens if I can switch off the struggle switch? With the struggle switch off, anxiety shows up, and it's not that I like it or want it or approve of it, it's just I'm not going to struggle with it. I'm not going to invest my time, energy, and effort in struggling with this anxiety. Instead, I'm going to invest it in doing meaningful, life-enhancing activities, such as spending quality time with my friends and family, or playing with my kids. Now, with the struggle switch off, the anxiety is free to move. It may get higher, it may get lower, it may move quickly, it may move slowly, but the point is it's free to move. It doesn't get amplified by all of these other emotions which make it kind of bigger and stickier and make it hang around for a lot longer. So there's no such thing as a life without anxiety. It shows up for all of us. But when anxiety shows up and the struggle switch is off, it's so much easier to live with when the struggle switch is on.
Okay, everybody, what do you think about that? Make sense? Let me know if it doesn't. The next thing that we're going to be talking about is self as context. So self as context basically means, when we talk about it with our clients, we call it the thinking self and the observing self as two different parts of the mind. So the observing self is the aspect of us that is aware of those feelings, thoughts, memories, sensations, etc. that our mind is generating. Meaning there's a part of us that can observe the thoughts in our head, that can see those thoughts. The part of us that can see those thoughts is the observing self. The part of us that's generating those thoughts is the thinking self. Now, this is the last one of the core principles that deals with creating distance or acceptance or whatever with those feelings. Helping us kind of deal with those feelings in order to be able to then create direction and make choices about where we want to head in the future. Guys on the webinar, thanks so much glad you like the videos. Awesome. So now the point of how self as context help us, or the observing self helps us, is because if we look at where it says noticing, right? Noticing is being able to be curious and look at thoughts, being able to notice that they're there, but not necessarily get caught up in or trapped or sucked into just focusing on those thoughts. So the fact that you're able to observe your thoughts means that there's another part of you that can make choices. There's another part of you that can deal with those thoughts in the way that you see fit. a lot of times it's so easy to think like, this is me and this is my mind and we are just one thing. But honestly, we don't have to be that way. There's a part of us that could be the thinking self, which is that mind that's generating those thoughts and those feelings. And there's a part of us that is the observing self that can then say, oh, these are thoughts and feelings. Now, what do I want to do with them? That gives us the ability to make choices about how we want to act once those thoughts and feelings show up. Now, a great way to kind of understand self as context is through the exercise that we're going to do next, which is just an audio, which helps us kind of connect to what we mean when we say observing those thoughts. So we're going to do that one right now. And then after we do self as context, we're going to take like a 5-minute break, because when we come back, we're dealing with the other part of the 6 core principles, the last 2, which is a little bit different. So after self as context would be a good time to just take a few-minute break, and then we'll come back and deal with the rest.
In this little exercise, you're going to learn how to use your observing self to take a step back and notice your thinking self, your thoughts, your cognitions, your mind. It's a very simple, quick exercise. So I invite you to close your eyes and just for a moment notice, where are your thoughts? Do your thoughts seem to be in front of you, above you, behind you? Do they seem to be inside your head, inside your body? Where are your thoughts? If your mind has gone blank, if there are no thoughts, just keep watching. Sooner or later, some thoughts are going to appear. When they do, are they in front of you, above you, behind you? If they're in your head, are they in the top of your head, the bottom of your head, the back of your head? Where do they seem to be located in space? When you notice those thoughts, also notice, are they moving or still? If they are moving, what speed and what direction? Also notice the form they take. Are they more like words? Are they more like pictures? Are they more like a voice in your head? As you notice your thoughts, recognize 2 parts of yourself in action. So there's a part of you thinking, generating thoughts, words and pictures that are popping up and disappearing, and there's a part of you noticing those words and thoughts, noticing those pictures. Let's just do this exercise just for 30 seconds more. Once again, notice, where are your thoughts? Above you, behind you, in front of you, in your head, in your body. Are they words or pictures? Are they moving or still? And as you notice those thoughts, be aware you're noticing. There are thoughts popping up, coming and going, part of you that's thinking and generating thoughts. And there's another part of you that's noticing, watching, observing. Observing self and thinking self, 2 very important parts of you.
Okay, great. So that helps us kind of understand a little bit more of what that self as context, the observing self, looks like. Because that part of you that can see those thoughts, that part of you that can observe them, is the part of you that's not connected to those thoughts. That other part is the thinking self. And when we understand that there is the observing self and the thinking self, then that is what gives us the choice to say, what am I going to do with those thoughts and feelings that the thinking self is coming up with? Okay, now we are going to take that 5-minute break. And when we come back, we will continue with values and committed action, which are the last 2 core principles, and then go through another few concepts that are related to ACT. We'll be back in a few minutes. Thanks, guys. I'm going to go get some water.
So I didn't have a break.
Okay.
have to go, you go. Look,
I'm so intimidated that when I found out that you
future inspiration. Okie dokie. Full transparency. This is my office.
Oh, it is?
I'm the boss. So that's why she knows I'm keeping her.
A hard time?
You know, one of the things is even my clinical staff is already licensed. They do some supervision with me.
Mm-hmm.
They're excellent. So which school are you okay?
It's called Kingsman.
What's that?
It's a charter school in D.C.
DC. Oh, did you travel? Oh, cool. Is it not a sleepover, is it?
It's not what?
A sleepover school, boarding school?
No.
Because we had one in, yeah, I hear. Because I worked in county schools for almost 4 years. And I worked in some alternative schools, were always my favorite ones. Kids get thrown out of school, they were my favorite ones. I worked with intellectual limited kids, and disabled kids, all the whole IEP, you know, most of the 06s.
Yeah.
You got 06 to it? SED? Sort of emotional disturbed?
Yeah, we have a lot of
09s?
Yeah. And a lot of our kids aren't diagnosed. That's the problem.
It's more behavioral things.
Yeah, but then you look at them and you be like, okay, you really need help.
Yeah.
But you don't have the IEP.
It's a very interesting. You have a psychologist there.
Mm-hmm.
There's some assessments that can tease out if it's emotional disturbance or if it's just behavior.
Uh-huh.
You know?
Yeah. I don't know. Then I think some of it might just be their environment and like who.
Right. When we talk, it's interesting when Mrs. Meyerberg,
Close.
when she talked about values.
Mm-hmm.
We'll see more about that because values are much different for lots of people, right?
Right.
I just want to check my phone, make sure.
I don't know if you have any kids ever do this. We had kids that say, and they would take the wallet and say, well, if you look at the wallet stone, why do you think it work? And you look at them like, huh?
Yeah.
Say that again?
Yeah.
Crazy.
Yep. They took one of the staff members' phone.
Oh, absolutely. You got to lock anything up with kids.
I don't know. My kids, I know. I'm just I said I'll go off on y'all, so you better not mess with my
Got
stuff.
these boots, right?
Yeah, and so they don't mess with me. So
Our last school was a high school. It was a very high school, middle from middle over here. It was just too hard to work with 1,200 kids, 1,500 kids. The city's not a school. I'm not retired, so I do this.
yeah.
Only part time. They work about 6 hours a week.
Oh, that's nice.
Yeah, so, where do you go to school?
Where did I go? I went to Maryland for my undergrad and USC for my grad.
Really?
Yeah.
Cool. Was that Charleston?
No, I to California.
Oh, USC, California. Oh, how did you come?
Oh, I did it online, so I didn't. I couldn't afford to live in California.
Well, I know that.
Or here.
No, yeah, I hear it.
Okay, everyone, we're back. I am sorry that break was a little longer than 5 minutes, but hope you all got to do what you need to do. And now we're back and focused. Before we continue, anyone have any questions? Anything they want to share? Anything that comes to mind? Anything that they have found helpful so far? Not helpful, that they want clarification on?
I'm finding that if you do a Venn diagram and you draw the similarities with other models or other theories, very similar. I see cognitive stuff jumping out all over the place. I see symbolic interactionism. We talked about things have meanings, stuff like that. So I'm seeing that kind of stuff jumping all out.
That's cool.
And even some of the tools you're talking about are very similar to cognitive behavior. And in mindfulness, right, there is a cognitive behavior mindfulness theory.
Mm-hmm. Cool.
John Kabat-Zinn,
Right.
1979, University of Massachusetts Hospital. Chronic pain, and he just got that's where he started it. Dalai Lama, wherever you go, there you are.
Mm-hmm.
I know a little about mindfulness.
Okay, that is cool. I didn't think about it like that. Like how it's like really connected to other models. Because I found like the idea of like the acceptance piece and like observing rather than like challenging or things like that was very different than like anything.
The mindfulness, you do observe.
Right.
You do observe.
In mindfulness, you do for sure.
So that's why there's a cognitive mindfulness behavior therapy, right? And also you're not see. You ever heard of behavior activism? Whatever it's called, behavior activism or something like that. It's you do it even though it hurts.
Right.
And I find that also in here.
Yep.
You do it even
That's
though it
exactly
hurts.
what it is. We're going to get to it later. There's like a line that like at the end when we talk about like hands-on with clients where it's replacing the word but with and.
Right.
Which is like I'm feeling I can't do this because I'm feeling whatever.
Yeah.
Or things like that. So it's either but or because. And then saying I'm feeling X and I'm going to do this.
Also some your processing therapy or something like that. Some of that, and also there's some narrative therapy, which all with words and linguistics and stuff like that. How you choose your words. Because
Right.
words you're saying have different.
Isn't it narrative therapy like they're writing stories of what they
Right.
experienced and things like
That's
that?
part of it, right. I mean, you'll find out that a lot of the exercises you have can be kind of generalized to a lot of different.
Mm-hmm.
When you start talking now,
You're good. Can Ebony ask, can you give an example of a judgment thought? So a judgment thought can be about a lot of different things, and that's why there's so much overlap. Like a judgment thought would be like, this person is X, or I am X, or this situation is never going to work out. A judgment is basically anything that me placing an outcome or a thought, like a description, a negative description on someone or something else or on myself. So let's say I'm trying to do something new and me saying, I'm never going to be able to do this. That's me judging me. That's me saying, I'm not able to. So before I even attempt it, I'm giving myself like the opposite of a head start. Like I'm putting blockages on myself to say, I'm not going to be able to accomplish something. So really judgments is actually the most general thing, because all of the categories are actually judgments. It's me judging a situation and saying this is or isn't going to happen, or this is or isn't good enough, or this person is or isn't doing something that I want them to do, or these people should be doing whatever. Those are all judgments on a situation or on a person.
and when we talk about AA, those that judge don't matter. Those that matter don't judge.
Yeah, that's a really good one.
I use that a lot. Did I ever tell that one before? You probably did.
I don't remember. Probably you did.
Yeah, I'm paying attention to those.
Now, is that clarifying, Ebony? Let me know, please. So now that we talked about those four core principles so far, which were, we'll go back to them for a second. Here, we did contacting the present moment, which is mindfulness. We did diffusion, which is creating distance. Watching your thinking. We did acceptance, which is opening up. Something about acceptance, actually, before we move on, that I wanna just say because I found it helpful, is one thing that we try to do in ACT when we're helping somebody accept something is actually making room for it internally. So we ask them to think about that feeling and kind of feel that feeling and breathe into it, like take a deep breath and make room for it inside of their body. And like almost like house the feeling inside of them. And that is a really powerful and also kind of visual way to open up and accept a feeling. I just thought that was, that's a cool way to kind of conceptualize acceptance. Susan said that it adds evaluation and assumption versus just describing the thought. Exactly. It's not just a thought of the sky is blue is just a thought, right? But a judgment would be the sky is blue and it's ugly. that's a judgment on the actual description of a fact. So a judgment could be basically anything that has a description in it that's negative. I'm judging myself, or I'm judging someone else, or I'm judging a situation. So we've done contact in the present moment, diffusion, acceptance, self as context, which is the last one that we just did, which is having the observing self and the thinking self. I just want to make sure, was that clear? Because that is often a hard one for clients and for people in general to conceptualize and to understand. And understand also why it's helpful to have that. So if anybody has any questions about self as context, please let me know, because I'm happy to clarify it again. The next thing that we're going to do now is values. So, like we said before, those 4 first ones are talking about what do I do in order to help me get out of being stuck in a loop of anxious thoughts and feelings, and depressive thoughts and feelings, and worried or sad or frustrated or angry thoughts and feelings. So now that I've been able to create distance or be more accepting or be more observing of those thoughts and feelings, okay, so now what? I've spent so much time being preoccupied with these thoughts and feelings, and now maybe I'm less preoccupied with it. So now what do I want to spend my life doing? What do I want to spend my time doing? I've freed up so much time and so much energy because I've been spending so much effort in being caught up in these thoughts and feelings, and now I'm not caught up in them as much. So I have now what do I want to actually be doing? And that's where values come in. So values, or is it?
In this little
Values is asking yourself questions like, what do you want your life to be about? And what do you stand for? Values are desired qualities of ongoing action. Clarifying values is an important step in creating a meaningful life. So at this point, like the last thing says, you know what you're trying to run away from or avoid, but where are you trying to get to? We've spent, like with our clients, they spend so much time trying to avoid, but now that hopefully they're doing less avoidance and more acceptance or more diffusion, what do they want to do with all that? What do they actually want to be doing with their life? So in our packet, there is a handout about values that I want us to actually spend a few minutes doing. It is page, got cut off on my handout. I don't know what page it is. Maybe 10? It looks like this. Do you guys see it? Right over here.
It will be 2 and 3 after the handouts. This one, 2 and 3.
Right. So, values are your heart's deepest desires for how you want to behave as a human being. Values are not about what you want to get or achieve. They are about how you want to behave or act on an ongoing basis. There are literally hundreds of different values, but below you'll find a list of the most common ones. Probably not all of them will be relevant to you. Keep in mind there are no such thing as right values or wrong values. It's a bit like our tastes in pizzas. If you prefer ham and pineapple, but I prefer salami and olives, that doesn't mean that my taste in pizzas is right and yours is wrong. It just means that we have different tastes. And similarly, we may have different values. So read through the list and write a letter next to each value. V equals very important, Q equals quite important, and N equals not so important. And make sure to score at least 10 of them as very important. So if you go through this list, there are 60 values. Really, 59 and 60 are insert your own unlisted values here. And then after you list those, after you go through all of them and you've labeled them, at the end it says, once you've marked each value as V, Q, or N, go through all the V's and select out the top 6 that are most important to you. Mark each of these with a 6 to show that it's in your top 6. Finally, write those 6 values out below to remind yourself that this is what you stand for as a human being. Yeah, thank you, Lisa. That's right. It says a quick look at values at the top of your page, page 1. That's the title of this handout.
Some of these are what we call shotgun, double-barreled questions. It's two questions for the same one. Statistic, in survey research, is kind of double-barreled.
Like which one?
Because it would say, caring, to care about towards myself and others, okay, and the environment. Those two different variables.
So it's not really questions, though. It's overall values.
Right. So, I could really help other people, but
I don't really care about the environment necessarily.
Yeah, so it's double-barreled.
So you can circle yourself and others and cross out the environment.
We have a research course.
Right.
I had a whole course on how to write research questions. So the cooperation from very good at that.
Maybe it's still a value, even if you're not good at it.
You're right. This is from him, isn't it? This is
From Russ Harris.
you can tell because behavior with you.
Right. They're Australian.
Yeah, that's
Mm-hmm. People on our webinar over here, if you would be so kind as to share some of the values that that you rated as V, we would appreciate it.
no means.
Lisa said courage, freedom, and flexibility. Nicole said equality. Ebony said gratitude. Susan said adventure, connection, fun, gratitude, and honesty.
Humility and spirituality.
Humility and spirituality. Cool. So what was it like for you guys to do this exercise? Anyone on the webinar want to share with us? Please do. What was it like for you to do this exercise?
I think what was interesting is I went through this and I was thinking how I would answer this as a young man, as opposed to how I answer it now. What things are important. For example, when I was a younger man, to be industrious, to keep striving to do more and more things and use my brain was really important. Just doing staff presentations and stuff. Now that I'm older, it's not that important anymore. To be creative, really. I'm curious. Now it's not important as it once was.
Mm-hmm. Do you think that's because you've gotten to this place in your life?
Right. It is. Eric Erickson says you reach a certain stage and you try to look back at your life and you kind of be like some helco. Be happy where you're at.
Mm-hmm.
I'm happy where I'm at. Content.
Cool. Nicole said, I think it would be a good exercise to do with clients. Yeah, I've found it to be very helpful with clients, and this is actually part of what one of the exercises that ACT uses in helping our clients clarify their values. Mm-hmm.
I do this a lot of exercises.
Oh yeah?
Not as extensive.
Yeah. And something interesting that people have told me when they've done this exercise that they felt is that sometimes the values that they pick isn't necessarily always the values that they're living by.
Huh.
And it's kind of
dissonance.
Right, there's a dissonance, and there's that gives them almost hopefully a motivation to be well, I want to actually become this person and actually actualize the values that I've checked off here as very important to me, because if they're very important to me, then why am I not living by them? What's keeping me from actualizing and living my life according to the values that I have chosen as very important.
Concept of motivation into the say this, but you don't this.
Exactly.
Ambivalence.
Exactly. Mary Beth said it's hard to pick just top 6 where most were important, but acceptance and authenticity. Great. Ebony said it forced me to pinpoint which values I operate in the most. And Mary Beth said caring, challenging, compassion, and freedom.
What would also be interesting is somebody with a mental illness, somebody who's depressed or anxious, how they would fill out something like this. It's almost a pre-post test. Because pre-test, a lot of these things, how they feel about themselves, they might care that they're so depressed. Interesting.
So you're saying if you do it at the beginning of treatment and then you do it again later on in treatment, you can see
sure.
Right, how things change and what
they're
motivated.
They care about creativity. You're someone feels like that.
Right. Right. But do you think that if you do this at the beginning of treatment, it might make somebody feel even less than? I can't even deal with what's going on in my life right now. Who cares about values?
Right. There's too many of them.
There's too many.
No, I mean,
I hear that.
Oh, yeah.
Yeah, that's why mine only has a 10 or so.
Right. I wonder why then he put so many.
Which is, and I think it's probably, a lot of them would be fairly close anyway.
Right. They overlap.
If you did a principal components analysis,
Yeah.
you would find that it can correlate some of them.
That's true. Okay, so just to clarify again, why are values important? Because once we understand how to create distance or not be so caught up in or not be spending all of our time avoiding difficult thoughts and feelings, then we want to know what we actually do want to spend our time doing and the values and the choices that we want to be making and how we want to be spending our life. Now, that doesn't mean that those other things are not going to pop up where we are going to never feel anxious or never feel stressed or never feel worried or never feel angry or depressed again. But the idea is that now we have the skills to deal with those feelings. So now that we're able to deal with those feelings, we're not spending so much time being preoccupied with being stuck in them or being preoccupied with trying to figure out how to deal with them. And therefore, we can free up some of that time in order to do things that are actually important to us. And that's why having those values and clarifying those values are so important, because that's what helps us then make those choices about the ways that we want to be living our life and the things that we want to be doing, the kinds of activities that we want to be engaging in, the kinds of relationships that we want to have, and making choices based on that information, based on the positive direction that we want to be headed. The next thing, our last one of the 6 core principles is committed action. Committed action is doing what it takes. Taking effective action guided by your values. You only succeed if you make a move. There may be pleasant and unpleasant feelings associated with these steps, but you're willing to do what it takes because these are the things that are important to you. And goal setting, behavioral activation, and exposure, which basically, that last thing, what that's saying is that now that I know what my values are, I want to be able to live by those values and create goals that are in line with those values. So I use those values to now say, well, where do I want my life to be headed? What do I want to be accomplishing? And sometimes in order to get somewhere that's important to me, I may have to face pleasant or unpleasant feelings associated with getting to that place. But now I have the skills in order to be able to deal with those unpleasant feelings that may pop up while I'm trying to get to that place, and therefore I feel equipped to be able to do it. And this is actually, committed action is the problem-solving part of the ACT model. This is where we do the goal setting. This is where we do behavioral activation. This is where we do exposure if somebody needs. This is where we say, what are the steps that you're going to take in order to be able to get there? How are we going to problem solve our way through this issue? How are we going to break this down into something that's manageable? One of the questions that, when we're in this part of the model, one of the questions that you might want to ask your client is let's say, like, if they're trying to accomplish something and you're giving them maybe some homework or something over the week in order to try to go towards that direction that they're trying to head in. So one helpful thing to ask is, let's say it's homework that you've given. So you say, or homework that they want to do. So you would say, on a scale from 1 to 10, how likely is it that you're going to come back next week having this accomplished? 1 being it's totally not going to happen. 10 being it definitely is going to happen. If they don't give you at least a 7, then that homework is too big. Because you don't want them to come back and feel like a failure, that they weren't able to accomplish it because it was too big, it was too much, it was too fast, whatever that is, and therefore they weren't able to do it. So if they give you less than a 7, then you break it down into something smaller until they give you a 7. A 7 is a good enough number that hopefully they will be able to follow through and do it. And the importance of that is, this applies to a lot of different modalities of therapy, in that, giving homework and trying to have follow through and trying to build up a client and build up their ability to, their belief in themselves, basically, that they're able to accomplish things. And if you give them something that's too big and they're not able to accomplish it, then that's not getting them to where you want them to be, helping them get to where they want to be. So when you're problem solving, it's just important to keep that in mind, that the things that you both mutually agree upon are things that are manageable, are things that are doable, and are things that they can follow through on, and then come back and feel good about. So that summarizes all the 6 core principles of ACT. If anybody has any questions or wants me to clarify any one of the 6, please ask. I'm happy to do so. There are a few more important things that ACT talks about that I would love to cover and go through. Now, the next thing is about psychological flexibility. So we talked about this a little bit at the beginning, where on that slide where it had the 6 core principles of ACT, it said on the bottom, this all functions in the context of psychological flexibility. So what that basically means is when somebody is, here, if we look at it in your handout, there's actually a big picture of the hexaflex, which is this, where if you see, there are 6 points here on our chart, which are each labeled with the 6 core principles. And then in the middle, it says psychological flexibility. What that's trying to show us is that we have to be flexible when we're working with our clients in jumping from one of the 6 core principles to another, given whatever the circumstances are that the client is presenting. At one point, they may need diffusion, and within the same session, they may need acceptance. And if you see kind of like the way that the hexaflex is labeled, you see acceptance and diffusion on one side, and then on the top you see contacting the present moment, on the bottom you see self as context, and on the other side you see values and committed action. And those are all kind of aligned, meaning acceptance and diffusion accomplish one thing, the idea of being able to both accept but not be caught up in a thought or a feeling. Contacting the present moment and self as context is using that part of the model, that part of the technique of being able to observe thoughts, to notice them, but with curiosity instead of getting caught up in them. And then on the other side, you see values and committed action, which is where we're headed to once we're able to accomplish the acceptance, diffusion, contacting the present moment, and self as context. Now, like we said before, this is all in the context of psychological flexibility, so that doesn't mean that it's a linear thing. We're not going from acceptance to diffusion to self as context. We may go from acceptance to committed action, back to diffusion, back to contacting the present moment, all within the same session. And this is also not necessarily, you model this with your clients in session by jumping from one part of the model, one core principle to the next. But this is also, the reason why you're modeling that is because that's what you hope they'll be doing with utilizing these techniques in their actual real life. That when they need contacting the present moment, that's what they're doing. But when they need diffusion, that's what they're doing. So they're able to be flexible within themselves regarding whatever they need at that time in order to help them deal with whatever thoughts and feelings are popping up for them. Does that make sense? Anybody on the webinar have any questions about that? So, that basically covers the whole gamut of what the 6 core principles are. Obviously, there's a lot more, we can go more in depth with each one of them, but that gives us a pretty, hopefully a pretty clear overview of what each of them mean and what each of them are trying to accomplish and how they could be utilized with difficult clients or with clients who are going through difficult times. This is just an acronym that people find helpful in understanding, like basic in like a little blurb of what ACT is really doing here. So when somebody is living in fear, they're living in fusion with your thoughts, meaning that they're attach to them. They can't get rid of them. They can't see past them. When somebody is living in fear, they're constantly evaluating their experiences, meaning they're judging them and they're caught up in them and they're evaluating themselves and judging themselves in whatever they're experiencing. When somebody is living in fear, they're avoiding. There's a lot of avoidance of experiences, and that's why they get caught up in behaviors that they have a hard time controlling, like addiction, or that they spend time doing things that they don't want to be doing because they don't know what else to do in order to deal with those feelings. And the last thing is when somebody lives in fear, they give constant reason giving for their behaviors. They try to excuse themselves for doing the things that they're doing so that they don't have to deal with the consequences of it, or that they don't have to face the fact that they're doing something that they don't want to actually be doing because they're just so afraid of whatever feelings or painful thoughts, memories, feelings, sensations, whatever might come up for them if they actually do face it. So that is the acronym that shows what a person is doing when they're living in fear. The healthy alternative to living in fear is to act. ACT stands for accept your reactions and be present, choose a valued direction, and take action. So accepting your reactions and being present means using acceptance and contacting the present moment, or diffusion, whatever works, in order to be able to deal with the fact that this is what is actually going on for me in my life right now. These are the painful thoughts, feelings, memories, sensations, whatever it is that's coming up. Choosing a valued direction, meaning clarifying values, and then living a life, taking action, which is living a life based on those values. So that's basically ACT in short. Now, the next thing over here is about experiential avoidance. Experiential avoidance is what ACT calls what people do when they initially come into treatment, and what they have spent a lot of time, energy, whatever it is, doing in order to try to control or get rid of unwanted thoughts and feelings. So if you read the slides here, trying to get rid of, suppress, or escape unwanted thoughts and feelings, memories, etc., experiential avoidance increases suffering. Spending a lot of time, energy, trying to get rid of things you cannot get rid of and feeling unsuccessful. Reinforcing negative beliefs, like I believe my social anxiety, I relieve my social anxiety by not being around people, reinforcing that I cannot control, I cannot be around people, and shrinking my social circle. So what that basically is saying is that by avoiding difficult activities, what a person actually does is saying, I really have this problem and I can't be around people because when I have these difficult thoughts and feelings. And the reason why I have these difficult thoughts and feelings is because I continuously get stuck in this loop of not being around people. So that makes it worse and that makes it more difficult. So experiential avoidance is any activity that anybody does that which they are trying to get rid of or suppress or escape unwanted thoughts and feelings. So like we said before, that could be addiction, that could be any sort of avoidance, that could be spending a lot of time and energy trying to get rid of things you can't get rid of. Any of that is called experiential avoidance. And experiential avoidance, like it says on the bottom, it causes addiction. It can cause addictions because when somebody is trying so hard to avoid something, they end up engaging in behaviors of whatever will numb those feelings that they're trying to escape.
Causes use. Maybe not addiction.
What?
I would say causes use.
Right. That's true.
Not necessarily addiction.
That's true. Causes the use of drugs or substance use, which then can cause addiction. That is a good point. And the reason why it's important to know what experiential avoidance is because part of the way that we help our clients adapt the ACT model is by helping them understand and point out what their specific experiential avoidance is. And part of the reason why that is important is because a lot of times people have a hard time accepting the fact that, like, what do you mean I can't control my thoughts and feelings? A lot of times people come in and when I ask them, well, what are your goals? They say, well, I don't want to feel upset anymore. I don't want to feel angry anymore. I don't want to feel depressed, or I don't want to feel anxious anymore. And what I tell them is, I'm really sorry. Like, I can't promise you that. And by helping them understand all the different kinds of things that they've avoided because they've been trying so hard to not feel whatever it is that they're feeling, that helps them understand why it's important to let go of that struggle and understand why it is a feasible expectation to accept or to diffuse rather than try to control. One of the questions that we ask sometimes to our clients, instead of this kind of relates back to functional contextualism, because we talk about workability. Workability means, is what you're doing working to make your life rich, full, and meaningful? If the answer to that is yes, then what you're doing is workable. There's no need to change it. If the answer to that is no, then it's unworkable, and we have to think about ways that we can do some things differently. So it doesn't matter, like we said with functional contextualism, it doesn't matter whether a thought is true or false, whether it's real or not real, whether it's bad or good. But what does matter is whether it's workable or unworkable. Because you're looking at the function of a thought, like we've said before. A thought that might sound bad could still be workable. A feeling that might feel uncomfortable could still be workable. What we're trying to help our clients recognize is whether the actions that they're taking, whether the thoughts that they're having, whether the things that they're doing are workable or unworkable rather than bad or good or true or false. Now, if you take what we talked about just now about unworkability or workability, and you talk about creative hopelessness, well, if you talk about experiential avoidance and workability, then that helps us understand what creative hopelessness is. So creative hopelessness is a technique that ACT uses in helping somebody develop the openness to trying to not control things. So if you see what it says over here, for worse, and get him in touch with the unworkability of his actions. This will create openness to an alternate way of handling thoughts and feelings. So what this is trying to say is, if you ask a client, we actually have a handout about that we'll look at in a minute, but if you ask a client, what have you tried so far to help yourself deal with these difficult thoughts and feelings? What have you done? What have you used? What techniques have you used up until now? And then asking, well, have they worked? And what have you had to sacrifice in order to try to make them work? And also, has it then come back or has it stayed away? So by helping a client recognize how much work and how much effort that they've put in order to help themselves, what you're trying to do is help them see, wow, I've tried all this stuff, and yes, I've put in a lot of hard work and effort, but at the end of the day, it hasn't worked. Trying to control and trying to like be on top of, in a way, trying to not letting go and not relinquishing that control and allowing those thoughts and feelings to be there. I've worked so hard to try to keep those things in check, and look how much effort and work I've put into that, but it hasn't worked for me. So if we look at our handouts again, where did I put them? At this page, it says attempted solutions and their long-term effects. So if you look at the categories here, it says, what strategies have you tried to control, avoid, fight with, change, or get rid of unwanted symptoms? The short term, were the symptoms reduced? The long term, did the symptoms return? Did they worsen or increase? And what has this strategy cost you in terms of wasted time, energy, or money, health, vitality, relationships? Has it brought you closer to a rich, full, meaningful life in the long term? So if we could take a few minutes now, and if you could think of, for yourself, to think of an issue that you have faced. Think of something that you have been working on or trying to control, and what that thing is, What strategies have you tried to use to control or avoid or fight with or get rid of these unwanted symptoms? And then filling out the rest of the form. The short-term effects, the long-term effects, and what has it cost you? And just because it's a helpful thing to try to practice on yourself to see what that feels like. And this is a helpful way to help clients kind of conceptualize this idea of what have I been trying to control, has it worked, and what has it cost me? Can anyone please, you don't necessarily have to share what you wrote on here, but even come up with some sort of made up example of what might fit in this kind of handout.
Which one are they presenting problems?
Sorry?
They're presenting problems while they come to you.
Right. Their presenting problem is,
They came to you because they were anxious, because they were getting in trouble at school,
right?
Things of that. This would be a very good thing to put in the assessment. When you do an assessment, this would really help.
Mm-hmm.
Kind of what things have you tried? Does it work?
Got it. Lisa said, since I'm in the community most of the time for work, I travel with a lot of bags. I realize that I don't use most of what I pack. So, what is the what is the short-term or long-term effects, and what has that cost you? So with Lisa, I guess I would say that the wasted energy and things like that, that it costs to carry around so much stuff, recognizing that that's not helpful, and then saying, well, what was it serving me, and now what do I need to do in order to make a change so that it doesn't continue to be, Lisa said, feeling tired of packing the car. Yup.
Back pain.
Yeah, back pain, exactly. And not recognizing that that's just not, it hasn't been workable. Even though you continue to do it, but it just hasn't really been working as well as you would have liked it to. So now, what's there to do about that? And including in that, when we talk about this with clients, the workability versus the unworkability of what things I have attempted, things I've tried, and things that have or have not worked. If, let's say, somebody comes in and says, let's say somebody comes in and says, I've been feeling really, really anxious, and I've tried to, I've tried to pretend like it's not there. I've tried to ignore it. I've tried to basically fight it, and sometimes it works and sometimes it doesn't work. So in the beginning, what we would write here is, what strategies have you tried to control it? I've spent money on different things that I've seen online that help me deal with anxiety. I've went to different kinds of therapists who have taught me different techniques, and some of them work and some of them don't work. So I tried all these things. In the short term, were the symptoms reduced? Sometimes. In the long term, were they reduced? No. That's why I'm here now again. And what have these strategies cost you? So sometimes they've costed me lots of money. Sometimes they've costed me time. Sometimes they've costed me like brain power, where I've tried all these things and then I end up feeling worse because it doesn't help. Uh-oh, my computer just went black over here. Oh, we're back. And because of that, I've been wasting so much time doing all these things, and it hasn't been effective. So that's what we talk about when we say creative hopelessness. We're saying, what have you tried? Not trying to make you feel bad that you've tried all these things that haven't been effective, actually trying to make you feel good. Like, look how hard you've worked. And look how much effort you've put into it. I'm sorry that it hasn't worked. It's not necessarily your fault it hasn't worked, but it hasn't. So do you want to keep doing that? Do you want to keep trying to do those same things that you have been trying, or do we need to try something else? And when you approach it that way, that's when a client may say, oh, I guess I do have to work on accepting it. Because all the things that I've tried haven't gotten rid of it. It hasn't made it go away. So if up until now all the things that I've tried haven't made it go away, then it must be that I need to try something different. It must be trying to make it go away just doesn't work.
As opposed to learned helplessness.
Exactly, as opposed to learned helplessness, which is basically saying, like, I can't do anything because everything that I've tried hasn't worked, so I guess I'm not capable of it. This is actually saying the opposite. I've tried so much. Look how much I've tried. Look how much effort I've put into it. And that's awesome that I've worked so hard, but I should feel kind of a little bit kind of discouraged in a way of it hasn't worked for me, and that's disappointing. But that doesn't mean that there is nothing that will work for me. It just means that I know how to put in the effort. I just have to find the right technique. I've spent a lot of time putting in effort, but it hasn't been effort necessarily in the right direction. What is the right direction that I need to put my effort into that will work for me? And that's where the relinquishing the control part. That's where we come to say, I have to let go. I have to accept. I have to diffuse. I have to do things like that and allow the feeling to be there rather than try to get rid of it, try to pretend like it's not there, try to ignore it, try to avoid it. Because up until now, those things that I've tried, which fall into those categories, hasn't worked. if we take this handout for a second and we write and we say that somebody's experiencing depression as opposed to anxiety, right? So with depression, what have you tried to control, avoid, fight with, change, or get rid of unwanted symptoms? So a lot of times with depression, people kind of avoid, right? So they'll drown themselves in, let's say, watching TV all day. They'll drown themselves in just sleeping. What?
Ice cream.
Ice cream, food, exactly. They'll drown themselves in whatever, in video games, whatever that looks like, so that they don't have to feel those difficult, painful, and hard feelings. And in the short term, were those symptoms reduced if somebody's avoiding like that? Yeah, I mean, while you're playing the video game, you don't feel it. While you're sleeping, you don't feel it. But then the next question is, in the long term, did your symptoms return? As soon as somebody stops playing the video game or stops sleeping or whatever, then those feelings return. And that is actually another reason why people may turn to drinking or something like that. Like when those feelings return after I sober up, I'm going to go and drink again because I don't want to have to continue to experience those feelings. So in the long term, did the feelings return? Yes. What has this strategy cost you in terms of all these things, time, energy, money? Well, with somebody who avoids, it does cost them a lot. Sometimes it costs them relationships, sometimes it costs them money, it costs them time, it costs them energy. There's so many things that people do that they spend so much time trying to avoid, which ends up costing them a lot of different things, where they don't end up living according to their values, like we've said, or doing any sort of committed action, because all their time is spent trying to avoid those painful thoughts, feelings, and sensations, urges, whatever it is. So that is what creative hopelessness is, and that is sometimes what we try to do at the beginning of the ACT model in order to help somebody buy into the idea that trying to relinquish control and trying to accept is a better alternative than the things that they've tried up until now. Okay. That was that. Okay, now we have, our next slide is about hands-on with clients. So this just talks about a little bit of the some of the techniques that some of which we've covered and some of which we have not yet covered in working hands-on with our clients in session. So one of them from the handout of the thoughts, where it says thoughts in the middle of the handout, hands-on with, where it says thoughts in the middle of the handout, your mind as a machine. That's what we talked about before, about like radio doom and gloom, or that your mind is a machine that generates thoughts and feelings of whatever it wants to. Utilizing those utilizing that imagery in session could be helpful to a client and helping them really see and understand what that mind really is, how that mind functions, and how it's hindering them from being able to let go, being able to accept, being able to diffuse from those things. Hands as thoughts was that exercise that we did earlier, also with you put your hand up to your face. Those are the thoughts that you're being preoccupied with, and being able to create distance, putting that hand away from your face and showing them that those thoughts can be there, but they don't have to be the only thing that's in focus. Bringing up the lights. Bringing up the lights is not something that we've spoken about yet. This is also another sort of imagery that you can help a client create that helps them understand, puts those thoughts in context. So you can actually start any kind of mindfulness or any kind of exercise with this little analogy, which helps them kind of put them in that frame of mind, which is basically this. Life is like a stage show. So everything on that stage is your life. So there's the people, there's the things that you do with your time, there's your relationships, there's your hobbies, and there's also your thoughts and your feelings. Everything is on that stage. Now, sometimes when we're focusing on one thing and we're preoccupied with it, it's like that the spotlight on that stage is just on your thoughts or just on your feelings. And it's preoccupied with that negative loop in your brain. But what we can do is bring up the lights. Let's bring up the lights on that stage and see what else is there. There's your thoughts and there's your feelings, but there's also your relationships. There's also what's going on around you. There's also the environment that you're sitting in, that you're participating in. There's also the things that you enjoy doing. There's the people that you're interacting with. There's so many other things on this stage show aside from those thoughts that the spotlight is on. So let's take that spotlight off and let's bring up the lights on the whole stage. Let's see what's in view when we look at the whole stage. And it's not that those thoughts and those feelings, they're still there. They're still on the stage. We haven't kicked them off. They're not going anywhere. But there's so many other things that are on this stage also. And they could also have the light on them as well. So life is like a stage show is a good way to start off an exercise where you're bringing up the lights, and now let's then shift our focus to those things. In addition to whatever feelings and thoughts are there. Like they said in Drop an Anchor, you're not ignoring those thoughts, those difficult thoughts and feelings that are going on inside of you, but that's not the only thing that you're focusing on either. So that's bringing up the lights. Then there's grounding / dropping an anchor, which is what I just referred to, which was that exercise that we did at the beginning, which talked about contacting the present moment of the environment of what's outside of a person. And then we also did the halo exercise, which was contacting what was inside of a person for people who are avoidant. Naming the story. Naming the story is a really cool exercise which helps a person with diffusion. Sorry, excuse me. So naming the story, similar to what we said before about being able to label categories, and saying like, oh, this is me, having judgment thoughts. This is me having rules kinds of thoughts. This is me having reason thoughts. Naming the story, what we're basically saying with that is we ask a person to think about what it is that, some thoughts that, why does this keep going black? Some thoughts that they are constantly preoccupied with. Either thoughts about themselves, thoughts about the way that they act or the things that they do or the way that they feel. And they write down a few of those thoughts. And then the next thing you do is ask them, well, when do you first remember thinking about these things? When do you first remember having these kinds of thoughts? And they could say like when I was 16 or when I was 6 or when I was 22, whatever it is that was happening to them in their life at that time that these thoughts first started to come up for them. And then you help them recognize, wow, this is an old story that you've been telling yourself for a long time. This is an old story that your mind has been saying for a long, long time. Now, once we have those thoughts, I want you to look at those thoughts, and now that they're written on paper, black and white, and I want you to think of if you had to name this story of these kinds of thoughts that pop up for you, what would you call it? The blank blank story, or the blank 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 story, whatever you want to call it. So let's say for somebody it might be like that their thoughts are about how they're never good enough, or that they're not able to accomplish anything, or they can't stick to something. So the story they might name the story the never good enough story. Or they might name the story, I once saw a video where he named his story the bad dad story, where he was never a good enough dad to his kids. So now, so you write down the bad dad story. Okay, so you have your thoughts, and then it says the bad dad story. Now you turn over the paper, and you write on the other side of the paper, oh, hey, I know this one. This is the bad dad story. Hello, bad dad story. And then you ask the client to read that to themselves, and that creates a sense of diffusion, where they recognize these are thoughts that I've been telling myself for a very, very long time. And these thoughts dictate the way that I feel and the way that I act. But you know what? This is just a story. This can just be a story that I tell myself. And whenever these thoughts pop up for me, I can recognize, oh, this is the bad dad story again. Hello, bad dad story. And I don't have to get caught up in it. I don't have to be constantly preoccupied with those thoughts when they pop up. I can be able to label them just as I could label any category of thought. I can label this specific story that is always popping up for me as the blah, blah, whatever story. And that helps me create that sense of disconnectedness instead of being fused with it, instead of being preoccupied with the whatever those thoughts might be. Is that clear? Okay. Now the next hands-on with clients right here on the last one on this page says from but to and. Sorry, I don't know what's going on with my voice. So when we talk about from but to and, it could either be the word could either be but or because. It doesn't matter. Right. So this applies to different kinds of thoughts. So there are a lot of times when a person might say, let's say, I can try to go swimming. If they're afraid of swimming, I can try to swim, but I'll be super anxious. I can try to meet a new person, but I'm going to look so dumb, or I'll feel worried the whole time. But if we replace the word but with the word and, what we're giving the client permission to do is say, I can go swimming and feel anxious. So what that means is, even though the feeling of anxiety is coming up for me, that doesn't mean that I should avoid the activity. That doesn't mean that I shouldn't do it. It means that I can do it and feel uncomfortable about it at the same time. So many times, like we talk about with functional contextualism, the thought is so overtaking, it's so over-encompassing, or the feeling is so over-encompassing, it takes you over that it's like, well, I can't feel anxious. You could, you're not going to die. It's okay. It may be uncomfortable. You don't like it, but that doesn't mean that it's going to kill you. It doesn't mean that you're not going to be able to live through it. You'll feel anxious, and that's okay. I can do something and feel whatever about it at the same time. So when you take a thought and you say, I can go swimming, but I'll feel anxious, or I can't do whatever because I'll feel whatever, you replace the word because with the word and, right? So I can't do and I'll feel whatever. Really, it's I can do and I'll feel whatever. So the point of that is saying, like what somebody commented before about, you take the fear with you to the party. It's not that you don't go to the party, you go to the party and you have the fear. And what you're showing yourself by doing that, you're showing yourself, or the client is showing themselves, that I am stronger. I can make choices. I don't have to let the feeling or the thought dictate the choices that I make. I can have that thought and still make the choices that I want to make, even though that thought or that feeling is there. Susan said that I encourage clients to practice tolerating the feeling. Yep, that's exactly what it is. It's tolerating that. That's DBT. What?
DBT.
That's DBT. There you go. See, there is a lot of overlap. So when you, like what we said before with acceptance and making room for a feeling, it's not that I want it. It's not that I asked it to be there. It's not that I invited it. It's that annoying guy at the party. But I'm not going to get rid of it. So the fact that it's here, I just have to deal with it. I just have to let it be there. And like we said before, the hope is that when I let it be there, it has no reason to stick around. Because we're not fighting with it. There's no reason for it to get stronger, so it does leave. It doesn't stick around. It goes, it comes, and then it goes. Sometimes, like he said in the video, sometimes it's faster, sometimes it's slower, but eventually it does leave. It doesn't stick around forever. The next thing, now, once we did all this, hopefully, more practical things with hands-on with clients, the second to last sheet in our handout says, let's practice the skills. And that gives us we're not doing this now. That gives us 3 different vignettes about fictional clients who are dealing with different symptoms And I want us to be able to work through them and say how we would use ACT in order to treat these clients. So let's start here. Let's practice the skills using the 6 core principles of ACT. Choose a partner and practice treating each of these clients. We're just going to do it as a group instead of choosing a partner. Susie is a 25-year-old female who has recently ended a romantic relationship of 5 years. She has been experiencing insomnia and has been feeling anxious and depressed. She is not sure how to move on. She has been unable to keep up with her responsibilities and is afraid she is going to get fired for calling out of work so much. So, what would you do?
Sinai. That was cool.
Saw you at Sinai, yeah. Which one of the ACT core principles do you think you would start with? Which ones do you think would be helpful in helping her work through
Something you have to accept.
accepting it?
Yeah,
What are you accepting?
That you don't have a boyfriend and you can at the end, right?
You don't have your boyfriend anymore and you can still function. You can still move on.
Right.
So acceptance. Yeah, that's a good one. What else?
One of the things I do, I talked about with you before, is look at the table in my room. I'll say, you don't have to accept that's a table, but you would spend an awful lot of energy defending it, whether it is or not. So how much energy does she want to expend on the thought about this relationship?
So how much energy do you want to expend on which part of that?
Right, the part before the end or after the end.
Okay. So which part do you want to spend, how much time do you want to spend on focusing on the fact that the relationship is over, or how much time do you want to focus on the fact that denying that the relationship is over?
How much energy do you have? Still like 100%.
Right. How much energy do you want to spend? I got it. Right. What about like diffusion or self as context? Any of those do you think is helpful? Nicole said, this kind of reminds me of dialecticals. You can accept something and still try to either move forward slash or do better. That's right. In dialecticals, that's what they say, that's why it's dialectic, that you can be accepting of where you are now, but have faith in yourself that you can still change.
Martha Lindman was depressed too.
Who?
Martha Lindman, the person that wrote it.
Oh, yeah?
Yeah, she
Linehan, yeah.
Linehan, whatever, she was depressed, but borderline or something. If I saw her, she was depressed, and doesn't saw her, she'd be borderline.
What sort of, what would you do about her insomnia?
Sleep hygiene.
Sleep hygiene, yeah. Anything like, sometimes it's helpful with clients to use diffusion with insomnia, like, or mindfulness, like cars passing in, the thoughts are like cars passing in the sky, passing on the road, or like clouds passing in the sky, or being able to say things like, I'm having the thought that, or I'm noticing that, so that they're able to distance themselves from that thought so she could help hopefully, relax enough and stay calm enough to go to sleep. Lisa said, using partializing, writing values, acceptance of the breakup, acceptance of single again, help with mindfulness before bedtime. Yeah, those are all great techniques. Okay, shall we move on to, the other one is that, just on the bottom where it says she has been unable to keep up with her responsibilities and afraid she's going to get fired for calling out of work so much. So obviously, that's just an important point to recognize that it's really affecting her quality of life. It's affecting her ability to function. So if somebody is affected by their ability to function, and like we said before, when we say, when do we try to, that ACT doesn't always advocate for acceptance, as long as there's no, if you can't control it. So it seems like she can't control it if it's affecting her ability to function like that. So that's when we have a clue of, I guess, that we need to work on acceptance. Susan said for insomnia, the halo, because it seems similar to a body scan. Yeah, it is similar to a body scan. Exactly. Helping her be aware of whatever feelings are going on in her body, helping her breathe into it, make room for it, allow it to be there, and then hopefully by allowing it to be there, she's not spending so much time and energy fighting it, which lets her calm down, help her go to sleep, help her deal with life, face the other things that are going on in her life, similar to like the thoughts, keeping the thoughts over here and still functioning and letting life happen. And be a be participatory in her life rather than just letting it happen because she's so preoccupied with those thoughts and with those feelings that are in her face. Okay, the next one is Aaron. Aaron is a 32-year-old male. He reports that he feels panicky and has what he thinks is panic attacks, especially when he is on his way to work. These symptoms started a while ago, but they have been getting worse. He gets nervous as soon as he wakes up in the morning because he is anticipating his ride to work. Once he is there and settled in his desk, he is usually okay for much of the day. So what do you think about him? What's going on? You can't read it? Which part? Oh, I'm sorry. I can go back to it on here. What do you want me to go back to? No, I think it actually is a good idea to go back to our list.
I can see the list. I'm just trying to look at the. I'm just trying to look at the definitions of each.
Oh, there's like many definitions.
Yeah.
Lisa said this sounds like the naming the story. So you think that naming the story would be helpful with this? Could be. That helps create diffusion. I think that any kind of, definitely naming the story, but any kind of diffusion techniques would be helpful in helping him kind of get himself out of bed through the morning and get to work. Because the idea is that once he's at work, he's really okay. So what can help him? What techniques can he utilize to help him just get to work? Some of it might be exploring exactly maybe what he is feeling so anxious about getting to work that's making him feel so panicky, and then working through those or helping him understand them and then accept them, that's just what happens. Even if whether they're true or not true, that's just what happens. And once he's been able to have that awareness to then develop that level of diffusion and saying, okay, so these are the thoughts and these are the feelings. This is what's popping up for me. I don't really like it, but this is what's here, so I'm going to diffuse from them. Nicole said, or talking about the judgments he's placing in the car ride. Right, labeling those thoughts as judgments, recognizing that he's judging himself. Mary Beth said he's needing to work with accepting the anxious feelings behind the driving, i.e. loss of control, etc. Right, whatever feelings are coming up for him that's causing that anxiety, whatever thoughts and feelings that are coming up for him that are causing that anxiety, he needs to be able to work with accepting that's what happens. Okay. Anyone else?
No, but what's funny in my mind is when I read the story, I go back to my cognitive training.
Yeah.
So it's hard for me to step out of that.
What does the cognitive training tell you to do?
Well, first of all, I'd have to see what's the stimulus. What's really making me anxious?
Mm-hmm.
That's what I keep going.
Right.
ABC.
Right.
Right.
Yeah.
And I don't think that ACT would say to not do that.
Right.
But that's not like it's like more of like the then what. So I know the stimulus, okay. Now what? Like, what do I do with that information? Do I accept it? Do I diffuse from it? Do I like use mindfulness? Like, what am I using in order to be able to then work through it?
Right. And since it just started a little while ago, it changed.
Right. And I agree with you. I would ask the same questions. Like, what changed? What is it that, why now? You know, but then the next step may look a little bit different than what like a purely cognitive or behavioral approach might be. Okay, the last one is Kimberly is a 65-year-old female who recently experienced the death of her husband of 30 years. Kimberly reports that she feels numb and out of touch. She finds herself staring into space and not knowing how she spent her time when hours have passed. She tries not to think about her husband and does not call her kids a lot because she does not want them to bring him up. She has been spending a lot of time alone.
Also, this one's how long ago did her husband die? If this was within the first couple of months, I understand. If this is after 4 or 5 years, it's different.
Right. Definitely. That's a good point. Asking when it started. Right. Let's pretend like this was a year ago.
Oh, okay.
I don't know. I'm just making it up.
With that, you mentioned it takes about 4 years before you
Mm-hmm.
get just the average.
Right. But even if somebody is still experiencing like that sense of loss, it doesn't mean that, in this case, it sounds like she's not necessarily dealing with it in a very healthy way.
Yeah, it sure paralyzes her.
She's spending a lot of time alone. To me, this screams like avoidance. You know, all the things that she's doing to avoid those painful feelings.
You know, when it's essentially your values, so what values does she have in her life that continue even without a husband?
That's a really good question. What values do you have in your life without a husband? And I would assume, this is me assuming about her, but I would think she would want to have a relationship with her children, and she's sacrificing one value due to the loss of her husband. So that's a really cool way to approach it from the values perspective rather than from like just the avoidance perspective. Susan said major avoidance. Yeah, I think so too. Anyone else have anything else to share? Anyone else have any questions? Because this is the end. So if you have any questions, please ask us now.
Almost dissociated. You know?
She's dissociated. Yeah.
What was the TED Talk?
The TED Talk, it's a long talk. That's why I just leave it in case we need it. But basically, it's Stephen Hayes.
Okay.
I'm talking about psychological flexibility.
Do you have any, like, if the values part, do you have it for, like, children? Because I'm thinking about my kids that I work with, and even though they're, like, they don't even know how to spell dog. So
Right.
I'm looking at this, I'm like, oh, I can't even use this.
That's a really good point.
I can't even read.
Right. Most likely, like Dr. Freeman was saying, if like you Google values, and you could come up with a list of values that would be a lot shorter.
Just do it.
The values clarification for teens, right?
Yeah.
The dyslexic ones, spell dog, spell God.
They're not even dyslexic.
They spell God.
They're just.
I know.
Oh.
Mary Beth said diffusion would be important to get her started on changing her thoughts about her loss. Yeah. Right. Being able to see the rest of her life in the context of the loss as well. Like there's the loss of her husband and the thoughts and the feelings that are associated with that, as well as all the other things that are going on in her life. If anybody else has any questions or any comments, please feel free to share. And after that, if you don't mind going into the evaluation form at the top of our page over here, it has a link to the evaluation form. And once you submit that, you fill it out and we get it, then we will email you your completion certificate or your CEUs. That is about it. If anyone has any questions, again, please feel free to ask. But thank you so much for participating and for your time and your interest. And I look forward to hopefully seeing you at future trainings.
How do you see everybody else?